Our speaker today is Marcelo Espiritu. He's talked to us before, and he's the director of health insurance counseling and advocacy program, the HICAP, and they go under the name of SourceWise, and it's a terrific organization funded by the state. They provide free educational information to people, sort of there for Social Security, Medicare, what we are for financial training and financial education. And the name, he'll be doing two presentations. The first one is Medicare Explained. He's just going to cover Medicare in general. Marcelo is director of HICAP by SourceWise. It's a state-sponsored Medicare volunteer supported program that provides counseling to people with Medicare about their benefits, rights, and options, and other health insurance related questions. Espiritu received state certification from the Medicare HICAP counseling in 2010. Since then, he has been an advocate for the elderly and individuals with disabilities who struggle with the complexities of Medicare and the hybrid options and decisions they face. As a director, Espiritu advises various HICAP counseling sites countywide. He is also responsible for recruiting and supervising HICAP's volunteers, overseeing their counseling, outsourcing community education. As a personal note, I've used their services. I used them when I first retired and set up, chose whoever was going to provide my prescription drug. I've used them since. I have one of their cards and a bunch of them. I've probably given 20 or 30 of these away over the years because it's a quality service, and it's a service that people really ought to be familiar with and use. And just as an example, when I set up my prescription drug coverage, I had a terrific vendor, and when the end of the year occurred, they raised the prices by 130%. So I went to another provider and used their services to do it. So with that, let's turn the time over to Marcelo. Basically, he'll present. Add your questions or put your questions in on the chat line, and then he'll take breaks at end of sections of his presentation and answer the questions. So Marcelo, you have the podium, the digital podium.
Yes. Well, thank you very much for having me. It's always a pleasure to come and present to your group. Again, my name's Marcelo Espiritu, and I'm with SourceWise Community Resource Solutions. I'm here with Stephen Rubalcaba, who's our community education and outreach specialist, and he'll be helping me field some of the questions that may come up. But as was mentioned, I'll stop at major breaking points. I'll take several questions at that time, then we'll move on in the interest of time. We'll certainly try to get to all your questions, at least at the end of each presentation. So I've been with SourceWise for just about 10 years now, and I actually started off as a volunteer myself. I was in the home building before that, and during some of the layoffs, trying to figure out, how to stay busy, started this volunteer program, and little did I know that I'd be interested in helping people with Medicare insurance. It's like a puzzle. It can be very complex, but it's been very satisfying. So, I'll start off by talking about SourceWise, and then our program, HICAP, and then we'll move into Medicare. As you may know, everyone sort of ends up in Medicare. So we help folks from all walks of life. And as such, there may be some things that you've been through already as I talk about Medicare, or if you're new to Medicare, then I'm sure you'll learn something new, obviously. But I think it's always good to know about one's Medicare options, even if you're in it already. Folks aren't sure sometimes what they can and can't do. So it's an apropos time. We're in the annual enrollment period at the moment. And it's a chance for people who are already on Medicare to sort of reevaluate their options and make any changes that they think they may need. So, so let me start here. At SourceWise, we're here to help folks age well at home. We provide expertise, education, and quality support services to Santa Clara County seniors, their families, and caregivers. And we do this through a number of direct services. So if you're to contact us, you would you could reach any of these groups. Information and awareness, also known as I&A, can connect folks to other resources in the county that you may need that we may not offer. We also have what's called care management. So this is for people who have low income and resources and need help with their care, developing a care plan and helping to coordinate their care. We also have a senior employment program for people 55 and over. For those folks looking to get back into the workforce, we subsidize their salaries with a host agency, just getting them back into work practice and skills, and helping even with resumes and so forth. We also have one of the various Meals on Wheels programs in the county. So our traditional Meals on Wheels are for people who are homebound and can't provide meals for themselves. These are frozen meals designed with senior needs in mind. But with COVID, there have been other emergency food programs. So we've sort of widened our offerings, but you can always check with us to see who or what the eligibility is for these programs. And then Stephen and I are with health insurance counseling and advocacy program, so also known as HICAP here in California. HICAP is primarily a volunteer-based service, and once we register our counselors after over 25 hours of training, 10 hours of internship, and registering with the Department of Aging, then we place them in various sites around the county that we've partnered with. So you can see, all the way up from Palo Alto down to Gilroy. We have partner sites at libraries, senior centers, some health centers. Of course, with COVID, these are predominantly closed to the public, or we're not doing face-to-face counseling at the moment. Our counseling right now is done over the phone or virtually like this with our counselors. So HICAP is part of a national program called the State Health Insurance Assistance Program. So if you have relatives in other states, there are services like ours. Often with these types of services, states have different names for the same thing. So in general, you want to look for your SHIP program, State Health Insurance Assistance Program. All of us are tasked with providing free, objective, and unbiased counseling. We do not represent any insurance company. We don't give any recommendations per se. We're here to provide information so that you or your family members can make a decision that works well for your needs. Our number is there, 408-350-3200. That's the main SourceWise phone number. And you can reach our other programs through that number. To reach HICAP, you would press option 2. And then we're actually transitioning phone systems, so bear with us. You'll hear some other messages, and but you'll get through to a HICAP person. If not, leave a message and we'll get back to you at this time, within 48 hours. We're starting to get really busy with the annual enrollment period. Other counties can reach their HICAP by calling this 800 number. And this 800 number will direct folks based on the area code from which their phone is. So when I call this, I have a 510 area code. It connects me to the Alameda HICAP. So just keep that in mind. 408 and 699 numbers will come to Santa Clara HICAP. Other states, again, you can go to the really good Medicare website. What's the official government website? Medicare.gov. And again, just look for resources and look for SHIP. And then you'll find the information, or your relatives will find the information they need, or friends. So I'm going to talk about the parts of Medicare. So we'll start like this. And I say parts of Medicare law because it is a law, and it helps explain maybe what you've all heard about Part A, Part B, Part C, Part D. There actually is a Part E of Medicare, but it's not anything you can enroll in. It just talks about miscellaneous aspects of Medicare. But Medicare it was cited in the law in 1965, or at least that's when it started. Part A described at the time what was called hospital insurance, and Part B described what they called medical insurance at the time. And back then, there were, delineations between the type of coverage, inpatient hospital versus medical insurance. You could have different types of coverage. Of course, nowadays it's so different, where if you're in, say, an employer plan, you just get everything bundled together. You don't see any distinction between hospital or medical coverage. But when you are in Medicare, this is a very important distinction, because the rules of Part A and Part B, enrollment, timing, costs, and premiums, they will differ. So in 1965, that was what people had, and they could take that anywhere in the country and go see providers, physicians, hospitals that were enrolled in the Medicare program. Later on, as managed care became more prevalent, Medicare said, well, okay, we'll allow private companies to take part in the Medicare program. The promise was that they would or could provide the same level of care at a lower cost to the program. So Part C was written into the law, and it's now called Part C, sort of the Medicare Advantage side of Medicare. So these are private companies that offer a managed way to access A and B benefits, Part A and B benefits that the red, white, and blue card affords you. So it's a different way of receiving your Medicare A and B benefits. Later on, in 2006, the Part D program started. This talks about prescription drug coverage. To access this coverage, again, you need to join a private insurance company that offers a Part D drug plan. Drug plans are also offered through Part C plans as well. So let's talk about enrollment, and specifically Part A and Part B enrollment. So how do you initially get into the Medicare program? Well, who tracks our work history? It's Social Security. So they are also in charge of enrolling people into Parts A and Parts B. So some people often ask, well, do I have to do this, or does it happen automatically? Well, to answer that question, if you're already receiving Social Security payments before age 65, and this could be in the form of retirement, because we all know that you can start Social Security retirement at 62. It could be Social Security disability payments. Well, if you're receiving either of those, then you can then enrollment in Part A and B is automatic. It's in fact tied to that benefit. So a card would be sent 3 months before your month of eligibility. So for most people, that's the month they turn 65. Or if it's due to a disability, it's actually the eligibility is the 25th month of receiving Social Security disability benefits. So there are different ways to get Medicare, but those are the two main ways. The other way one can be eligible for Medicare is by being diagnosed with what we call end-stage renal disease, so kidney failure. So if you need to be on dialysis to live or need a transplant, Medicare is available as well at any age. Now, if somebody isn't receiving Social Security payments before 65, and many people are delaying that because they know that as one delays past their full retirement age, the amount of Social Security payment goes beyond 100%. In other words, you get more if you wait more. So if you're in that boat, you're delaying that, then it's not automatic. So if you choose to enroll in Medicare, you'd have to file an application with the Social Security Administration, SSA. So you've seen these offices, maybe, there's one in Mountain View, Campbell, San Jose. So you can find your local office at ssa.gov. There, and you can talk to somebody through their 800 number. You can actually find the local phone number by going to the Social Security office locator, and they have an office number. Because of COVID, they are now accepting faxes for applications. Before they wouldn't take those. And you can enroll in A and B. If you already enrolled in A, you can submit an application for just Part B. If you're retiring, so it really opened up the options. Keep in mind, you do not have to be retired to enroll, at least in one of these parts. So, so just as an example of an enrollment period in Medicare. So there's something called the initial enrollment period. And some of you may have already gone through this or not used this, but it's come and gone depending on your situation. But this initial enrollment period is a 7-month window. It's your first opportunity to enroll in Medicare. So in this example, let's say Phil turned 65 on April 2nd. This is his 7-month window, 3 months before, 3 months after April. And yeah, so this is his opportunity. Keep in mind, a lot of people don't realize this, but if you're entitled to what's called premium-free Part A, which if you've worked enough and paid taxes for over 10 years or more, then you're entitled to free Medicare Part A, and you can sign up at any time. You're not bound by this window. Okay. Those born on the 1st, however, are considered to turn 65 the month before. So you would just shift all of this over. There's a delay if you use the latter months of your initial enrollment period. So for example, if you submit an application before your 65th birth month, then it would start on the first day of your 65th birth month. Once you delay, then the actual start date starts moving out according to this chart. Now, Medicare law changes, and in fact, there's a new law that will do away with this delay. So in a not this year, but next, I think it's the 2023, this delay will go away. Whichever month you enroll in after your in the last 4 months, it'll just start the month after, but no earlier than your 65th birth month. Now, a lot of people ask, well, and more people are working past 65. If you're employed after 65 and you have a group health plan, an employer group health plan because of that work, what should you do? Should I enroll in premium free Part A? And you generally say yes. Since it's free, it's hospital coverage that would supplement or be secondary to your employer hospital coverage. There is an exception now, and we've seen this more and more. Employer plans are putting more of the cost onto employees. And sometimes these make quite a bit of sense, especially for those who don't use a lot of health services. But there are what are called health savings accounts with a high deductible health plan. And if you want to look this up, the rules are in IRS publication 969. But the IRS says that if you have one of these, you can't contribute to your HSA when you have Medicare, when you are enrolled in A or B. So in a situation like this, we're telling people, if you want to continue to contribute to this HSA, don't sign up for Part A or Part B. And when you decide that you're going to enroll or retire, then we suggest stopping your HSA contributions 6 months prior to filing for premium free Part A. And the reason this is because when, as I mentioned, you can sign up for free Part A at any time, but the rule is it starts retroactively. So the start date will be backdated 6 months. So effectively, you've had Part A for 6 months. Any contributions in that time would be considered excess contributions and possible and subject to a 6% excise tax. So you'd have to take that money out and pay your taxes on it. So load your HSA up front if you can, 6 months before you intend to sign up for Part A. Of course, you can, Part A, of course, won't go back more than your 65th birth month. So, you can always contribute all the way up to your 65th birth month and beyond, but keep the Part A effective date in mind. The next question would be Part B. So when should I sign up for Part B? Or may I sign up for Part B after 65 while I'm working and have a group health plan? Yes, you may. You can delay Part B. Everyone working past 65 with a group health plan has what's called a special enrollment period, and it's ongoing. And when it ends, it depends on when you retire. So during that time, you can sign up anytime. Most people don't because they already have an employer plan. There are rules about if it makes sense. If you work for a smaller employer, then you may want to come and talk to us because they're a little more, there's some other issues involved with that. Who pays first, who pays second, things like that. So special enrollment periods. So I just mentioned that. In order to have a special enrollment period, a person needs to meet 2 conditions. As I mentioned, 1, you have to be enrolled in an employer or union group health plan, and that plan or coverage must be due to what we call active employment. It's also known as current employment status. of either you, the worker, or a spouse that you're covered under. If you have those two things in place, then you're in your special enrollment period after 65. A lot of times we have folks who are using COBRA. Maybe their company has paid their COBRA its insurance, so why not keep it? You know, it lasts for 18 months sometimes, or more for family members. Why don't I just use this instead of Medicare? Well, the SEP ends, or the clock starts ticking, I should say. The close of the SEP will happen 8 months after the group health plan ends, or you lose active employment status or current employment status. So regardless of what you have, this clock starts ticking. COBRA will not extend this time. And if you miss this special enrollment period, then there are possible late penalties for Part B, permanent late penalties. So be careful. Talk to us if you have questions about timing. But again, COBRA does not count for the purposes of a special enrollment period. I've had some clients who've just missed the IEP and their SEP completely, in which case the next chance to sign up for Part B or Premium A, there are folks who just don't have the quarter credits for free Part A, is what's called the general enrollment period. This happens the first of the year, and coverage, though, is delayed until July. Again, the law is changing. That 6-month delay will be eliminated, and coverage will start, the month after January, February, or March. But there is still a possible permanent penalty, and it's a 10% increase, Part B increase for each 12-month period that somebody could have enrolled but didn't. I have folks who work overseas, and they're sometimes confused about, should I'm in another country, I have health insurance there through the national health plans, like in Germany or in England. Does this still apply to me? So people, so although somebody, if they're working and they're covered by the national health plan, then they're also considered to be in a special enrollment period. But if they stop working, although they're covered by the national health plan, they don't have an SEP, and they need to sign up for Part B to avoid this penalty. And a lot of folks, well, you can't use this Part B overseas, of course. But to avoid the penalty, you'd need to sign up. Part A has a penalty for those who don't qualify for free Part A. Okay, so now let's turn our attention to once a person has both A and Part B, the two ways to arrange your Medicare. Sometimes we call it, how do you set up your Medicare? Which way of accessing benefits do you want to use? So we'll get into that. But at this time, let me open it up for some questions that folks might have at this time. So I don't know if people can maybe unmute to ask a question, or we should go through the chat.
So we have, excuse me, so we have a current one in chat, Marcelo. I'll go ahead and read it.
Thank you. Okay.
Oh yeah, when not enrolling in Medicare after the age of 65 because of other coverage, keep a copy of every annual letter that the coverage applies for avoiding Medicare penalties. I guess, is there any type of proof of coverage that we need to keep on hand, Marcelo?
Right. So if we're talking about employer group health coverage, I'm not talking about a private plan that you may have, because that's not going to help, or Covered California, that's not going to help. But employer group health coverage, right. So when you later do sign up Social Security will ask you, of course, for the Part B application, but they'll also want to know from your employer, one, how long you were employed or that you were employed after 65, and that you also had their health coverage. So there's a CMS form that typically employers fill out that's attached to the application. But sometimes folks have worked with companies and they've gone out of business. So yes, I would say, keep track of your health plan information to show that you were in a group health plan. That always helps to help document that. And there are other forms of documentation that can be submitted, tax information showing your contribution to a health plan. So yes, good point. Next question. Yeah.
There was another one that popped up in there, Marcelo. What is the deadline to avoid penalties if still working versus retired for parts A, B, D, etc.?
Right. So remember, we have to keep we have to talk about these in the parts. So so far we've looked at part B and A, and I would say, the deadline for signing up for part B to avoid a late penalty is to sign up within your special enrollment period. So which ends 8 months from when you retire or lose your group health plan, whichever happens first. So there's an 8-month period in which you ought to submit your Part B application. After that, then there's a chance you might have a late penalty, depending on how the months that we're talking about. We haven't talked about Part C or Part D. Part D, of course, is drug coverage, and there is a late penalty for Part D, as in drugs. And the rule is that if you don't have other what's called creditable drug coverage, in other words, your plan doesn't have creditable drug coverage, which means coverage actuarially as good as or better than the standard Part D coverage, then you could be subject to a late penalty if you're eligible for a drug plan. So there's no such thing as creditable employer plan. Specifically, the word creditable in the Medicare world applies only to the drug benefit portion. So when it comes to the Part B, avoiding Part B late penalty, Social Security doesn't care what type of group health plan it is. If it's any good, they don't care, as long as it's a group health plan. It could be the worst group health plan, hence not seemingly creditable, but that doesn't matter. They're not there to evaluate how good your health plan is. They only want to know, is it an employer group health plan, to avoid the Part B penalty. For Part D, on the other hand, they do care that it's creditable, good as Medicare's drug coverage. Kind of a long answer, but
no. A great answer. And you know what? Since we're talking about that, maybe you can clarify. Let me see. There was a question about Part A enrollment and Part A being mandatory once we turn 65. Perhaps you can briefly elaborate, the rules on Part A enrollment and whether or not we will get a late enrollment penalty.
Okay.
Thank you.
Yeah. So Part A, if you're entitled to Part A, by that I mean you've worked or your spouse has worked and paid FICA taxes for 10 years. And you can ask Social Security or go to their website, create an account, and you'll see, do you qualify for free Part A? Are you entitled to free Part A? There is no possible late penalty if you miss your IEP or SE. there's no penalty because 10% of zero is zero. But if you don't, or your spouse doesn't, neither you or your spouse has accumulated 40 quarter credits, then there is a Part A premium, depending on how many quarter credits you've received. So those who've immigrated to our country may have no quarter credits, in which case they would be responsible for over $400 to pay for the Part A premium. Now, if those folks sign up late, if they miss their IEP, then there's a 10% penalty for every 10% penalty. And that penalty, that 10% penalty, lasts for twice the number of years that they delayed enrolling. That's slightly different than the Part B late enrollment penalty, which can go, it's not limited to 10%. It's 10% for every year that was, every 12-month period that a person didn't sign up when they could have. And it's permanent. The Part A late penalty is limited to the number of years, based on the number of years that you delayed, twice the number of years, and then it goes away. But that's a lot to pay still. Okay, I think that answers the late Part A penalty.
Yeah, thank you. So Roland, we'll go ahead and answer that question when we get into the Medicare Advantage option. I think it may be more appropriate. Okay. And there was another question, Marcelo, maybe you can touch on it briefly, and then we'll go ahead and continue on.
Thanks.
This one is the VA doesn't avoid Medicare Part B like boy penalty, but does avoid Part D like drug penalty. That's the question.
Good point. Yes. So that's true. So VA is a completely different and uncoordinated system from Medicare. So neither of those work together. In other words, we have situations where someone is retired, has Medicare and maybe a retiree plan from a company. Medicare will pay first, the employer retiree plan will pay second, and maybe the beneficiary doesn't see a bill at all. But with VA, if you have that option, it's sometimes a tough decision. Should I sign up for A and B? I have VA benefits. Well, if you're not in a VA area, then and you don't sign up for Medicare and change your mind later, there could be a late penalty. In any case, the person points out that VA doesn't extend or affect in any way positively the Part B special enrollment period. It's not employer group health coverage. However, it does provide creditable drug coverage, and that having VA drug coverage can help one avoid the Part D late enrollment penalty. In other words, if you have creditable drug coverage, including VA, whatever, it's as good as Medicare drug coverage. You don't have to have a Part D drug plan. But if that creditable drug coverage goes away, which it won't with VA, but sometimes other things like COBRA drug coverage is often creditable. Once it goes away, you need to get into a drug plan for Medicare. If you don't, if there's a gap of 63 days, there's a chance for a late penalty. It's not as much as Medicare's, and I'll show you that later. Yeah. All right, so let me move on then, and we'll talk about the ways a person can arrange their Medicare. In other words, you can, what we call, use original Medicare as it was set up back in 1965. Different options have been added or are now available to help offset the costs of original Medicare. So although I think at this point we all know that when something says it's covered, it doesn't mean 100% coverage. So they're out-of-pocket costs. And in the 70s, there was something called a Medigap that was introduced into the insurance world that could take care of these out-of-pocket costs of original Medicare. And of course, you could add a drug plan to that. So that's one way to have or use your Medicare. The other way is to take your A and B and then by virtue of having both A and B, joining a Medicare Advantage plan, or what's called Part C. And they include, for the most part, all of them except for a few now, covered drug as well. So we'll look at these two options, and keep in mind, if you have a retiree plan and Medicare, so if you have Medicare A and B, Medicare would be primary. That's just the way the rules are written. If you're retired, you have Medicare A and B, a retiree plan will come in second. Retiree plans nowadays often mimic option 1 or option 2. A retiree plan can look like a Medigap, or just supplement all the costs, maybe add some extra health plan benefits. Or the company may create a retiree plan that is filed with Medicare and looks like a HMO, Medicare Advantage plan. So keep that in mind. All right, so let's start with the first option, original Medicare. You're just using your red, white, and blue card. Again, the power of original Medicare is that you can go to any practitioner medical group that accepts Medicare in the US. Now, I'll make a, this year, we're seeing changes. Sutter PAMF is a large medical group in Northern California, and they have said that their primary care physicians will only be will not be accepting original Medicare beneficiaries in order to access their primary care physicians. For new folks, they'd have to go through Part C of Medicare. So this is a really big shift in our area. Typically, we would say this: you can go anywhere, but this is again a change, and we're sort of monitoring this. What gets covered under original Medicare, and for that matter, Medicare Advantage, which has to provide all the same benefits as original Medicare. It has to be what's called medically necessary and reasonable for your situation. So that's the guiding principle, but there are a lot of details and criteria, and that's handled often by Medicare contractors. There's some things that aren't covered by Medicare that are specifically spelled out in the law, but I'll go over those shortly. So again, original Medicare, it's not an HMO where you need a primary care physician to access specialists. Okay, that came later with Part C. So this is just a chart of some of the benefits, going into the benefits of Part A and Part B. Under original Medicare, it's often known as fee for service, which means, how does the money flow? If you receive a service, you pay a fee, and Medicare pays its part, you pay your part, in the form of deductibles and co-pays. And I'll show you what those are. So in general, these are the 4 areas that Part A covers: inpatient hospital care, skilled nursing care, home health care through a home health agency, and hospice care through a hospice agency. So these facilities, skilled, home health, hospice, are registered with Medicare, and you can go to any of these. You have your choice. Part B covers outpatient care services. Whether you're in or out of the hospital, Part B will cover physician services as well. There are also preventive services that were started with the Affordable Care Act. I think we all recognize that if you can prevent something, then it would save Medicare money and help your health. So there's the introduction of what's called an annual wellness visit. Typically, you think of this as like your annual physical. It's not a physical per se, so don't expect to be palpated and measure what. It's more of a paid visit with your provider, so it's free, and a plan of care can be established, so which can trigger necessary free screenings or other programs that might preventive programs that wouldn't cost you anything. So I always encourage people to ask by name for your quote annual Medicare annual wellness visit. That then the scheduler should know, okay, it's a specific code, it's free, you get it once every 12 months. And so there are now free preventive services, but only a really designated list. Remember, Medicare is very it covers things that are typically acute care. So if there's a problem and it's documented, then that's what Medicare is for. There's a short list of preventive services. So some folks get caught with lab tests that we think, oh, I'm going to take a, I want to see what my counts are. Well, there has to be medical necessity behind it. Otherwise, you're going to get a bill. If your physician says, well, I want to run some tests because of X, Y, and Z, then Medicare would pay for it. But be careful of those lab tests. Ask and ensure, why am I taking this? Take notes to help support any possible issues later. Part B will also cover home health. And you might ask, well, why does Part A cover it and Part B cover it? Well, Part A covers home health for a certain number of time after discharge from hospital or from skilled nursing care. But once that home health benefit expires, you can get home health under Part B. Or if you're not in, or if it's not started in a hospital or from a nursing home, you can still, if you need it, get home health care from Part B alone. Diagnostic tests are typically covered. Therapy under Part B includes physical, occupational, speech language pathology. There aren't any caps, but there are requirements for your therapist to document the medical necessity again. And then, of course, durable medical equipment, prosthetics, orthotics, and supplies are also covered under Part B. What's not here there are also called Part B medications. Oftentimes, cancer medications, anti-rejection medications are covered under Part B, and they have co-pays as well.
Hey, Marcelo, I know I get this question a lot, and it popped up in the chat, and there are, it's about the home health care. So
yeah.
The question is, how long is this home health availability period? And also, some of the questions that I personally get are, well, home health care, is that for personal care, perhaps like domestic services, bathing, toileting assistance? What do they mean by home health care? And yes, as the question mentions, how long is this available for, or what's the availability period?
That's a really good question, and there's a lot of, I'd say, inaccurate information about it. So, first of all, home health care agencies provide services. In the Medicare world, home health benefit is triggered. There are a number of factors that are required. Of course, you need to be under doctor's care. Must be a care plan in place. And I will have a slide later showing the requirements, but one important requirement is that it's for primarily skilled, intermittent skilled nursing care or therapy. So these words are important. Skilled, what is skilled? It has to be arranged or performed by a licensed nurse, therapist, and it can't be daily, otherwise you'd be in a nursing facility. Intermittent, so not 7 days a week. It also depends on, I think therapy is not 5 days a week. You also have to be homebound. And when you think about that definition, Medicare has specific definitions for homebound. It would be very difficult for you to get out of the house. I mean, you can of course go to your services outside the home, but it takes, I don't know what the actual term is, but a lot of effort to get out of the house. So there are strict criteria about that are needed to trigger a home health benefit. Personal care, however, is different than skilled care. So when we think about personal care, some other terms might be custodial care. Basically care that helps a person with what are called activities of daily living. So ambulating, getting in and out of a chair, changing clothes, sometimes cooking, toileting, getting help with that. So these are personal care services that are not covered by Medicare. The only time Medicare would cover it is if it's in conjunction with a home health care. So if you have a plan that requires skilled PT and OT, then personal care services may be allowed. And as far as, so for example, let's say somebody has a stroke and they can't bathe themselves, or they need help bathing. Help with bathing is not a skilled service. It's what's called, it can be provided by a personal aid or unskilled. But Medicare will cover that if it's in conjunction with, say, physical therapy. So can't have it alone is what I'm trying to say. As far as duration goes, how long can this last? Well, if there's a plan of care in place by the doctor and there's still a skilled component in that, and it's intermittent, follows other criteria, then the personal service can go on as long as that other criteria is met. Sometimes people will say, oh, Medicare doesn't cover long-term whatever, but sometimes there is ongoing care, and if it's medically necessary and it meets those requirements, it could go on indefinitely, again, as long as that criteria is there. So it's not easy to access, and home health agencies, they're balancing, staying in business, how much they get paid, and there aren't many incentives sometimes to continue that type of benefit for their clients. It may be more, it depends on their mix. So that's a very long answer, but I think it's sort of in the context of long-term care as well. So I just need to get that out there. So,
thank you, Marcelo. We did get some nice comments and saying that's fantastic clarification, and I would also have to agree. Thank you for speaking on that subject. And one more quick one before we move on. Can you briefly mention the orthotics about original Medicare? One of the questions earlier on, and I don't know if we mentioned this or not, but says, I thought orthotics were not covered under Medicare. and has this changed recently? And then also there were some folks mentioning some topics about the Medicare Advantage routes. So at the moment, Marcelo's still talking about original Medicare. We're going to dive into Medigaps or supplemental plans, also Part D, like drug or prescription meds. We're certainly going to get into the Part C or Medicare Advantage options, perhaps some of the benefits or the advantages. And someone referenced Kaiser. So yeah, we're definitely going to get there. Thanks for being patient with us. But yeah, maybe the orthotics component, Marcelo, maybe you could answer that one briefly. I know I get a lot of questions about that too.
Okay. So I'm going to share, I know I just stopped sharing, but I want to go to this website. So let me share again. Okay, so what I did is I searched for Noridian Medicare. Noridian is our claims adjudicator, and they also have a website that, and we are in jurisdiction E, Part B. So orthotics is under Part B. And within this website are sort of the details of what's covered. So orthotics, very limited situation is it covered. It's typically, you have to have certain criteria. So last time I looked, it has to, you have to have a diabetes and problems with your feet because of diabetes, and you need orthotics because of that. So it's medically necessary to have orthotics. I use orthotics, but I wouldn't meet the criteria, even though I have an accessory navicular bone. Anyways, I need support, but I think under Medicare, since I, knock on wood, well, I wouldn't meet the diabetic criteria to have orthotics paid for, but that would be found here. So maybe if I did a search for orthotics in Noridian Medicare, then you sort of have to put your research hat on and look for under what situation is orthotics covered. So again, Noridian Medicare, jurisdiction E, you can see California, and it's a Part B service. Okay, so right now we're talking about original Medicare. As you can see, this is one of our sheets that we counsel people with. We've talked about A and B, and let's go into, I think we're ready to go into Medigaps, but let me just switch back to my presentation. Okay, can you see this slide? Is that clear? Okay.
Yeah, looks good.
Okay, thanks. So so what's not covered by A and B? So let's be clear about this. Long-term skilled nursing home stay. Nursing home room and board, etc., is limited by Medicare up to 100 days during what's called a spell of illness. Only 100 days. If you go out of a nursing home and remain out for 60 days and then come back in, then you're in a new spell of illness, what's called a benefit period. Then that 100 days gets reset again. That doesn't happen often, but it can. However, the services you receive in that, like let's say it's expired, Part A no longer covers nursing home. Part B, you may be able to get some Part B services still. Medicare doesn't cover anything having to do with routine dental care or the teeth for that matter. It's very limited by law. And that's why you hear these days, let's get Medicare to cover dental because it is so important for folks as we get older. I have a lot of dental problems. I'll need it in the future. But dental plans, good dental plans, we aren't really trained in that at HICAP, but there are a lot of search tools now that can help you find good dental plans. very limited again, like in preparation for cancer surgery. Don't fall for, implant dentals. Medicare doesn't cover things like that. Dentures doesn't cover routine, as I mentioned earlier. So even routine vision. So corrective lenses, corrective exams, not covered by A or B. But of course, medically necessary vision issues, Medicare will cover. So cataract surgery, things like that. Of course, the lens is sort of a basic lens. You can upgrade that, but Medicare covers a certain level of lens. Hearing aids are not covered by original Medicare, or exams for fitting hearing aids. Cosmetic surgery. Now, acupuncture used to not be, but now in a very limited way, acupuncture is being used to treat lower chronic back pain. And I think, yes, so, and but it's limited. Medicare does not cover care outside of the United States. Sometimes people ask, well, what about cruises? Now that those are maybe opening up again. So the general rule is if you're 6 hours to or from port, then Medicare can cover the service. So before you see your doctor, the medical doctor on the ship, ask, how far are you from port? And then you'll get an idea of maybe it's covered or not. Others, things that are not covered, Medicare.gov will often indicate that too, or the Noridian website. We already talked about the Part A premium. I'm sorry, this is probably should be up front, but here are the amounts of the Part A premiums. And then these are some of the costs when admitted to the hospital in 2021. So there's what's called the hospital deductible. And you pay this once per benefit period. Again, if you're out of the hospital for 60 days, that closes the benefit period. You come back in, then the deductible needs to be paid again. But if you're in the hospital for over 60 days, then these are the copay rates. The nursing home facility, typically Medicare covers the first 20 days if you meet the criteria. And then beyond that, to 100 days, it's $185.50 per day. In original Medicare, there is a requirement that folks have a 3-day inpatient hospital stay prior to going into the facility. And this is a very unpleasant rule for some folks, because maybe you're sitting in the hospital for 3 days as an outpatient being observed, but you're not meeting this 3-day inpatient rule. But if you need subsequent nursing facility stay, you think, oh, Medicare is going to cover it, but it's not. It wasn't an inpatient. You weren't formally admitted, so Medicare won't cover it. I mean, I've heard of a few situations like that. To help with that, hospitals are required to give you notice of your status. It's called the Moon Notice. I think it's Medicare. I don't remember the acronym, but it's all in the paperwork the person gets in the hospital, basically saying we're informing you of your inpatient or outpatient status. If you don't need skilled nursing facility care, then it doesn't matter. But if you possibly do, then it does matter. These are the Part B premiums. It goes up by income. Social Security or CMS looks at, communicates with the IRS to figure this out. It's based on your latest income tax, and they're looking at modified adjusted gross income to determine your Part B premium and the adjustment based on your, what we call MAGI from 2 years prior. So here's the chart for that. Original Medicare has a deductible every year, $203 in 2021. So in January, if you see the doctor, you're responsible for the first $203. After that, once that's met, then it's typically 20%. So again, to help with those out-of-pocket costs, Medigap plans are an option for folks. Again, also you can get a drug plan. So this is the typical setup for someone with original Medicare. Just so you know, if you know anybody that needs help with the Part B premium, there are other programs that help. If somebody qualifies for Medi-Cal, which is California's Medicaid program for low income and lower resource individuals. There are also what are called Medicare savings programs. And there are 4 types, 3 that help pay the Part B premium, depending on federal poverty level amounts. So I think federal poverty level for a single person these days in 2021 was just over $1,000 a month. So, QMB, Qualified Medicare Beneficiary, has the lowest income limit of 100%. So when somebody has that level and has below, say, $2,000 for a single person in assets and resources, they could get help with Part A and B. These just do Part B. And then by qualifying for these programs, that same person would get help with Part D drug premiums and out-of-pocket costs as well. No need to force them to make an application. It just happens automatically to assume that they would qualify. All right, so let me move into Medigap plans to supplement Medicare, original Medicare, we should say. They're sold by private companies. You have to have A and B for it to actually begin. You can sign up ahead of time, but if A and B aren't active yet, then it won't start. They cover the out-of-pocket costs of original Medicare A and B. And there are standardized Medigaps. Before they became standardized, agents were selling multiple plans to people sometimes, and folks didn't know what plans were covering what, or that they were over-covered or double covered for the same benefit. So since then, there are now standard plans with letters, not to be confused with parts of Medicare. These are plans. Medigap plans A, B, D, G, K, L, M, N. And we still have plans C and F, which if you were eligible for Medicare before 2020, you could have one of these. If you don't, but you were eligible, you could still get into one of these C and F plans. But for the newer folks, only A, B, D, G, K, L, M, N are available. Medigap plans are not health insurance. So although the Affordable Care Act said health insurers cannot screen people and deny people based on their medical history, this type of insurance, it's like a stopgap type insurance, can still use health screening, just like long-term care insurance can underwrite folks based on their medical situation and history. But there are times where insurance companies must sell you one, can't take into account your health history. So the rule is that you have what's called a Medigap open enrollment period when you start Part B for the first time. Assuming you have A, you also have A. But Part B, the start of Part B triggers your enrollment period. You could have, this is the first one, let's say. No health screening is allowed. Also, if you have A and B and you lose other kinds of health coverage, like an employer plan, or you decide to get off a retiree plan, or even COBRA, when that ends, those occurrences will trigger a 6-month open enrollment period also to get a Medigap, no questions asked. Another example of when to get a Medigap, let's say you are in a Medicare Advantage plan, Part C, which we'll talk about later, and it raises rates, increase costs, or reduces benefits in the or plans to do that in the upcoming year. They'll give you advance notice. They won't tell you that you have a Medigap right to a Medigap. So you do have to look at your annual notice of change and see. There are distinctions, though, between types of Medicare Advantage plans. Some Medicare Advantage companies also sell Medigaps. If you're in that and it raises rates, et cetera, then you can buy their Medigap plan. If some Medicare Advantage plans like Kaiser, Stanford, no longer Stanford, but other types, their parent companies don't sell a Medigap plan, then the increase has to be a little higher, or a dropped benefit will trigger the chance to get out of the Medicare Advantage plan back to original Medicare, and then easier to get a Medigap under guaranteed. It's called a guaranteed issue, right? No medical underwriting, and we can help you with that if you're in that situation. Of course, if you're healthy, you can purchase a Medigap with Medicare A and B anytime. You just have to answer the questions and pass them. Companies will have different stringency of screening. So, but keep in mind, you'd have to drop a Medicare Advantage plan to get into a Medigap. But so you want to make sure that you put the Medigap in place first before you drop the Medicare Advantage plan. Or you need to know that you have a guaranteed issue right. And then they often require proof that you're disenrolling in order for them to activate that Medicare Advantage or Medigap. Now, in California, we also have what's called the birthday rule. So if you already have a Medigap plan, and as was mentioned early in this presentation, sometimes the pricing goes up quite a bit. I had a client who was 90 years old, living in the villages, and she was paying well, I think it was almost over $500 a month for a Medigap plan. And so what we did was we used this birthday rule where you can switch plans to a plan of equal or fewer benefits on your birthday and 60 days thereafter without underwriting. And so she was able to save hundreds and hundreds of dollars a month by using her birthday rule to look at Medigap, other Medigap plans. And again, you can switch Medigap plans anytime as long as you pass their medical underwriting. And what does it actually cover? So this matrix shows you the different out-of-pocket costs in original Medicare. You're already familiar with some of these I showed you. So hospital coinsurance at the top, the Part B, 20% coinsurance, blood, first pint, hospice, it's very minimal costs in hospice though. Skilled nursing facility coinsurance, that's really co-payment, but it's that amount after 20 days. Part A deductible, hospital deductible, etc. So you'll notice over here on the right, the red circle, those are the only plans that cover the Part B deductible, the $203 at the beginning of the year. Congress said, well, we need Medicare beneficiaries to feel the pinch, otherwise they're going to overutilize their services. Well, whether that's true or not, this is what happened. You can keep your CNF plan. If you're eligible before, you can get into them. But now the next most comprehensive plan is the G plan. It covers all of the benefits except for that deductible. And then there are plans in between. If if you're a good numbers person, you don't mind looking at these and weighing your risks. Some of these plans may be of good value depending on your financial situation to handle the different risks involved here. We take our Medigap supplement rates from the Department of Insurance. So if you go to insurance.ca.gov, you can find a list of sample rates. Okay, so let's stop here and talk about Medigaps. Are there any questions at this point?
Yeah, so I think we're fairly caught up on Medigap questions. I'm glad you brought up. There was one question in the chat about Medigap's plan C like cat and F like Frank. So yeah, as the screen indicated, for folks that were eligible for Medicare in 2020 and beyond, cannot purchase Medigap's plan C and F. For
Correct.
folks that were eligible for Medicare prior to the year 2020, can.
Yes.
Okay, great. Okay, thank you, sir. Just wanted to make sure that was clear.
Yep. Another question.
yeah.
Sorry, I was going to say if there are now these things called enhanced Plan Fs, and they not only do they cover all these benefits, but they might include other benefits, like maybe dental or vision, etc. They call them enhanced or so if you have a Plan F already and want to move to an enhanced one, you can use your birthday rule. There's no underwriting. Those F plans are considered equal in the eyes of this law. So you're protected from medical underwriting. Again, if you want to move to like an F plan into an enhanced F plan. There are high deductible plans. I forgot to mention F and G have high deductible plans where, only after you meet a deductible does it cover practically everything. But those are considered very low benefit plans, but they might make sense if people have, the cash on hand to cover the deductible every year. You're saving quite a bit in premiums. But it's considered low in terms of the law, and if you can move up without underwriting, no. So, okay, you had another question, Stephen, then we'll move on.
No, I think that kind of gets us all caught up, I believe, with questions. But if anybody does have a question, feel free to voice it yourself.
Okay.
But I did see one just pop in. What extras do enhanced F plans have?
So
and then I think after that, Marcelo, yeah, we can dive on to part D, prescription drug meds, to try to get back on track.
Right, sorry, I know. So they can include dental, vision benefits. They can include AARP memberships. I've heard recently, sometimes a gym membership. But you'd have to check with the plan, and you'll those are some examples. I know I'm running a little behind, so I'm gonna up to speed with part D. Drug coverage. With original Medicare, you can add what's called a standalone drug plan to your setup. You need at least A or B or both to be eligible. And drug coverage can also be had through a Medicare Advantage plan. But again, to get into Medicare Advantage, you need both A and B. You don't need to sign up if you have creditable drug coverage. And that's someone who mentioned earlier, you need the documentation from your employer group health plan. Every year they send you whether it has creditable drug coverage or not. It should be in the plan documents. By law, they're required to inform you, and you can always ask for that from the plan as well to add to your document list as you prepare for Medicare. When do you enroll in Part D? So there's an initial enrollment period. same as your, when you first start Medicare at 65. If you don't need it or don't, then you can do it when employer or other credible drug coverage ends, when you retire, let's say. But again, you must have drug coverage within 63 days, creditable drug coverage, or Medicare drug coverage to avoid the late penalty. Every year, like we are in now, you should check your drug plan if you're with original Medicare. We see sometimes the pricing for medications is all over the place. I mean, by that I mean there's no standard that plans. They can price generics. They put them in tiers now, and then the tier defines how much you pay. I've seen generics in tier 3, tier 4, and I've seen brand name drugs in tier 2. So now they're adding extra tiers. And come and talk to us, or if you're savvy, you can go to medicare.gov. They have a plan finder where you can enter your medications and your pharmacy and your zip code, and it will tell you the cost of the various plan offerings. This is really important to do. We save folks thousands sometimes every year, making sure they're in the same plan. Don't assume that the plan you're in is the best one for the upcoming year. The premiums vary, but that again is not the way to pick a plan. You need to put your drugs in and your pharmacy, and then compare the different pharmacy and plan options to come up with a good plan for the upcoming year. And you want to check the access to the medications. Ideally, all medications are on the plan formulary, so you don't pay the full price of the medication. Just like Part B, there's an adjustment on top of the premium, the plan premium. CMS will adjust or will give what's called a Part D adjustment amount based on your modified adjusted gross income. This is the website, medicare.gov. They change these, they're always improving it. So you want to find health and drug plans. There are different links, but that's the place to start. I mentioned earlier, there's help for people with low income and resources. So these are the amounts under which one can qualify, either automatically through those other programs or submitting an application if they don't get it automatically. Okay, so we've looked at the original Medicare setup. I'm sure some of you have that. The advantage again of that is access to providers throughout the country. That's probably what you want if you have a residence somewhere besides Santa Clara County. If you use a lot of services, that may be the best way because it can help limit out-of-pocket costs, and you don't have to well, it really depends on your medical situation too. So let's move into Medicare Advantage. So Part C, we have a lot of plans in our area. Because we're an urban area, we have a lot of medical groups and hospitals. A lot of plans are active. In rural areas, you won't see this because there are network requirements that must be met. People need access to a certain number of providers, et cetera. So here's original Medicare. The other option is Medicare Advantage. What you're doing by joining is you're taking your A and B benefits and assigning it to a Medicare Advantage plan, and then you get a Medicare plan. We have here Medicare HMO, so you get a new card. We're seeing new PPOs coming back into the market. They were here years ago, but it just, they can come in and out. I think it was 8 or 9 years ago, we had an Anthem PPO Medicare Advantage. Now we're seeing an Aetna PPO and a United Healthcare PPO in 2022. But the majority are HMOs. Again, they all practically include drug coverage except for one, I think. which if you have VA, that might be the one to be in. Medicare Advantage, private companies, you have to be in their zip code service area, which is typically county-based. People with end-stage renal disease used to not be able to join these, but now they can starting this year, sorry. And hospice benefits, where one is diagnosed to have less than 6 months left to live, is now can be wrapped into Medicare Advantage plans. That may not, that means you have to use their network, their particular hospice agency. And that may or may not benefit you. Depends. If you want to find a better one, you've got to be in original Medicare, or maybe it works out fine. Part B medications, they can require you to use a lower cost medication. But if it doesn't work, then you step up to the one that maybe was originally prescribed. That's called step therapy. And they can do that now with Part B drugs. The main difference between original Medicare and Medicare Advantage Part C, of course, is this managed idea where you must be in an HMO with a primary care provider who then directs your care to specialists within that medical group that you're assigned to. You can change primary care providers, and that's how you change from one medical group to another, is by changing your primary care provider to one of a different group. It takes effect the next month. That's just how the contracts are typically written. There are out-of-pocket costs and deductibles in these. With the Affordable Care Act, there's now a maximum out-of-pocket limit to copays and co-insurances for hospital and medical costs. Again, you can't use Medigaps for these, and there are extra benefits that can be added to these plans that original Medicare doesn't. So to sign up for these, they're very similar to the timing of Part D, where you can sign up when you first are eligible, during a special enrollment period, when you lose other coverage. And every year you can join or switch or drop a Medicare Advantage plan. So October 15th through December 7th, we're in it now. You can go from original Medicare to Medicare Advantage. You can go from Medicare Advantage, drop it, go to original Medicare. But of course, you'll want to have a Medigap set up or know that you have a guaranteed issue right before you do that. There's also a 5-star special enrollment period. So if somebody finds themselves without like drug coverage or exposed to original Medicare outside of the AEP, 5-star rated plans can enroll folks anytime of the year. And the only 5-star rated plan is Kaiser Medicare Advantage. And then there's also, if you have cold feet, join Medicare Advantage. You can switch or drop in the beginning of the year as well. So differences between original Medicare and Medicare Advantage is, of course, where you can go for care. You have wider access with original Medicare than Medicare Advantage. The premiums and out-of-pocket costs. So full coverage in Medigap is the premiums are higher, but the out-of-pocket costs are more limited. Whereas with Medicare Advantage, the premiums are lower, but you will have out-of-pocket costs, albeit capped at various levels. And then extra benefits. Original Medicare has extra things like routine dental, routine vision, routine hearing. They're adding other things that help folks with activities of daily living. Depends on the plan, depends on the chronic need of the member. And sometimes they're adding transportation, meals after hospital stays. They're getting a little more, they're allowed more creativity in assisting their members. Foreign travel, actually, certain Medigaps have foreign travel coverage. Medicare Advantage plans also have foreign travel emergency and urgent care coverage. There's no underwriting with Medicare Advantage, but there is underwriting potentially with Medicaps. So those are some of the major differences between having original Medicare with a Medigap and Medicare Advantage. Be careful for enrolling late. We already talked about these, just summarizing. To keep on top of timing, and talk to us if you have any questions about what you can and can't do and when. Also, watch out for fraud and abuse. I'm sure everyone's gotten phone calls. Keep in mind, Medicare is not going to call you. Social Security is not going to call you unless you've initiated something yourself. Watch out for free genetic testing, back brace scams. They're really after your Medicare number because they will sell that or and use it to bill Medicare. And then it could, because all services are tied to that Medicare number, affect your access to whatever it was that was billed. So if you see something that doesn't look right, you can talk to us. We have what's called we're with a senior Medicare patrol, and we can move things up and try to help against that fraud and abuse. So with that, let's move into any questions that remain.
Oh, Marcelo, well, yeah, thank you for covering all those topics, Marcelo. I mean, I know it's a lot of information. We've gotten some solid feedback and a lot of engagement via the chat feature. I believe we may be fairly caught up on chat, but I think now's a good time. Yeah, we'll certainly take some questions. We'll definitely answer them, but I'd like to hear folks' questions. So if you'd like to voice your question, maybe we could unmute you. You could unmute yourself, and by all means, ask away, because I know there's a lot of information Marcelo unpacked. So let's go ahead and go before we dive into the next topic.
Okay.
Does the Part D penalty apply to Part C?
Yes. So if you're in Part C, which has Part D included in it, and you have a late Part D penalty, you'll still be charged.
Thank you.
Mm-hmm.
Would you explain what overseas medical coverage is provided by the Plan F? I know it's
Yes.
limited, but just how much is provided?
Right. Let me actually go to that chart. There are limits to it. So 80% coverage for emergency care in foreign countries after a $250 deductible, and there's a lifetime max of $50,000. So so you have to keep all the records and bills and then submit those, and your plan would pay 80% after a $250 deductible.
If you also have travel insurance, would that be, which would be primary?
They don't coordinate to my knowledge. That's a good question. I don't know, but I would say don't rely on Medigap foreign travel emergency coverage. I would suggest getting foreign travel insurance as well, especially for the transportation side of things, if that's needed. But I'll have to look into that. It probably depends on how the contracts are written. I don't know. Good question. So I'll try to find out.
Thank you.